Going abroad. We're often asked about our prices in comparison to clinics abroad for doing full arch dental implants. The prices in Turkey or Hungary, and oftentimes it looks very, very appealing. It could be 2/3 of the price. Yeah, there will be a bit of a trip, but I'm going to get my teeth sorted abroad. And I'm not here to scare you or to dismiss it out of hand, but I'm here to give you the full picture that the clinics abroad don't tend to share up front. And the first of these points is that the headline price is usually for a straightforward case. And oftentimes these clinics will charge more for cases that aren't straightforward. So we charge just one price. That's it. And that's your price. The only option that you can decide is if you want a different type of teeth from PMMA to zirconia. That's the only additional that we charge. Full mouth implant treatment is rarely straightforward. If you need extractions, if you need bone grafting, if you need additional surgical work, that's typically added on by these clinics overseas. By the time some patients get their final bill, it's significantly more than the number that caught their eye in the first place. Get a full itemized quote before you commit to anything. And you're going to have to take a risk to get that quote, because you're going to have to travel to get your CBCT done. You're going to have to travel to meet their clinicians and get their treatment plan. It's really not possible to give you a quote without having done that. So any reputable clinic will need you to do that in the first instance. So you may have to take that risk as well also. The other part that some patients don't take into consideration is that full mouth implant treatment is not done in one trip. You need to have an initial consultation. You do need to go in and have your surgery done. But then you need to do follow-up checks during the healing phase. We do what's called a post-surgical data capture after the osseointegration period. Typically that can be anywhere from 8 to 12 weeks after your surgery. And so you cannot do that at the time. You have to wait for the implants to bond with your bone. Nature has to take its course. So that's another trip that you're going to have to do. And then after that post-surgery data capture and another intraoral scan should be taken, and then they'll go and design your final prosthetic, and that takes some time, and that's at another visit as well. You've got a minimum of 3 to 4 visits. Maybe clinics that don't use guided technology like ourselves or photogrammetry like ourselves, they may need more visits.